tomorrow could be better. Maybe today's bad, but tomorrow could be better. Nothing lasts forever. Life is just a series of ups and downs, and we can swim against the wave or we can just kind of roll with it.
Hello, everybody, and welcome to Talking Health with Health Solutions, a brand new podcast that is being recorded at Health Solutions, a nonprofit organization that has been serving the Pueblo and surrounding areas for over 60 years. On today's episode, we have Dr. Stephanie Payne. Thank you so much for being here, Dr. Payne.
Thank you for having me. I'm excited.
We're so happy to have Dr. Payne with us today on our podcast. And we've had some episodes that have just been outstanding to talk about not only what Health Solutions does as a whole, but just our community and what you have to offer here for women's health and primary care. And we're just excited to have you. So for those of you who don't know us, we are your host for Talking Health with Health Solutions. My name is Melissa Ayala. I am the Director of Health Solutions Inpatient Services. And then I'll let Nancy introduce herself.
Hello, everybody. My name is Nancy, and I am the Suicide Prevention Coordinator.
And Dr. Payne just joined Health Solutions. Is that right, Dr. Payne?
In November.
In November. So We're so excited to add her, and we're just kind of throwing her to the fire today and asked her to join our podcast and be a part of that. And she, I don't know if she knows what she got herself into, but she agreed, and we're super excited to have her. But Dr. Payne, so give us a little background, kind of where you started and why you decided that Health Solutions was one of the places that you wanted to end up at.
I started at Southern Colorado Family Medicine, so I did my residency there. I finished up there and decided to stay here in town and keep serving this community. So from there, I went to Pueblo Community Health Center and was able to do women's health there as well. So at the Community Health Center, I got to work with so many great OBGYNs, midwives. I also did deliveries at Parkview. So
Wow.
I did a 24-hour shift at Parkview every week for last several years, almost a decade.
Wow. Bringing those babies into the world.
Bringing the babies into the world, learning from the OBs, the midwives, L&D nurses, doing so much women's health care and some primary care there. And, I'm getting close to 40, 24-hour shifts are getting harder.
Yeah.
So I decided to step away from doing deliveries, and Health Solutions was just a really good fit for what I wanted. I wanted a good mix of primary care, women's health care, and I think mental health plays such a huge role in physical health. So I love that that's so integrated already into Health Solutions. So that was a big thing for me, was being able to have mental health care, trauma-informed care provided to our community. So I'm so happy to be here.
Absolutely. We've talked a lot about that in this podcast of how it's such an integrated approach here at Health Solutions, and this is just one more avenue of women's health, bringing that on to help facilitate that it's not just about physical health. It's about mental health. It's about overall well-being for individuals, and that's something that we're really priding ourselves on here at Health Solutions, to continue that process of getting individuals seen in a one-stop shop, as Madison kind of conveyed to a lot of our listeners, that we can really start being that as we bring on individuals like yourself to provide that care for our clients in our community. So can you tell us a little bit about your expertise as far as women's health, and what is your focus while you're here at Health Solutions?
So my focus is being family medicine as well as having advanced women's health training. So I get to take care of all genders from birth to end of life. But in that spectrum, my passion is definitely women's health care. So providing hormone replacement therapy during menopause, perimenopause, making sure women feel heard and validated. I think as we transition through life changes, oftentimes we feel like we're not being listened to, like we're not being heard. I really want to focus on making sure everyone feels heard, but especially women. Women take care of everything. The community, the families, the people who care the most should also be cared for the most. So that's really important to me.
Yeah,
Mm.
absolutely. Dr. Payne, you talk a lot about the focus on women's health, and that's something that you're really passionate about.
Mhm.
What made you be like, that's where I want to go? That's the route I want to take.
Oh, I love this question. So I've been really lucky to get to travel all over the world. And one thing is always the same, no matter where I am in the world, Africa, Europe, etc. Women are always the cornerstone of their communities, their families. They're providing the emotional support, the mental support, physical, social. Everything is being held together by women.
Mm.
But the opposing reality that also exists is the health disparities.
Mm.
They're not unique to the United States. They're not unique, to specific countries. It's something that women face all over the world, is that there are significant health disparities for us.
Yeah.
So what really drove me to women's healthcare was, how do we close the gap? We have these two realities of people who care but aren't getting cared for. So that's really what drove me to women's healthcare, is making a change and
Yeah.
helping educate others, especially upcoming young physicians, to do that as well.
Absolutely, absolutely. Dr. Payne, I don't know if Melissa knows this or not, but I don't. Are you originally from here, from Pueblo? You said you traveled a lot. Did you graduate here?
No, I grew up in very rural Missouri. The first town I lived in had 80 people total.
Wow.
We had 2 churches and a bar, so I guess the churches were winning. And from there, my best friend and I moved to Africa about 5 days after graduating high school, and
Wow.
That's a big move.
Yeah.
Yeah, our first time on a plane. We're like, okay, let's go there.
80 people to Africa.
Yeah. So we taught English, math, science in Ghana. Then we both moved back for college. I finished college in Missouri and then moved to South Carolina for medical school. And then I came here for residency.
Wow. Wow.
That's quite the journey. And something that you've talked a lot about, and a passion that you have through your journey of women's health and working here at Health Solutions, is hormone replacement therapy.
Mm-hmm.
And something that we, through our research, have learned that on November 10th, the FDA removed the black box warning connected to hormone replacement therapy. So can you tell our listeners a little bit about what that means and how that has impacted the work that you're doing within that field?
Yeah, so back in 2003, there was a black box warning issued on HRT, so estrogen, progesterone. Um, Part of that was, the FDA generally wants to keep everyone very safe. So there was a small study done, mostly older women who were outside of menopause for 10 to 20 years, that showed within that population there was a slight increased risk of breast cancer, cardiovascular disease, and stroke.
Wow.
So the FDA decided, based on that one small study, that they were going to issue a black box warning. That's the most intense warning you can get on a medication. But we are now in 2026, so we've had almost 30 years of, new studies come out showing, wait a second, maybe the study wasn't done that well. And, a hormone replacement therapy really should be started within 10 years of menopause. And when that is done, we actually see improved cardiovascular health, improved bone
Wow.
health, brain health. With estrogen, for women who don't have estrogen receptor positive breast cancer, it actually is protective against breast cancer.
Wow.
So, with the black box warning removal, we're able to more openly discuss HRT. We're able to start integrating it back into our medical school training, into residencies, and patients feel a lot more comfortable and open talking about it. For so long, women have thought, if I take HRT, I'm just
What
going
will
to
happen?
perish. Yeah,
Mm.
something terrible will happen to me. And that's really pushed women away from what can really make them feel a lot better, a lot less suffering, but also protect things we don't think about. So I don't think we think about perimenopause and menopause also mean bone loss. It means
Mhm.
genital urinary symptom changes.
Gotcha.
Um, things
It's
that
not just the mood swings.
it's not just the hot flashes. It's not just the mood swings. HRT is about so much more than hot flashes.
Yeah.
We can offer a lot of relief with HRT for the right candidates, and it can really be life-changing for women.
Yeah. Dr. Payne, what is for our listeners? What are some maybe recommendations that you would give for women to come in and seek this treatment or seek this medication? Is there something that you're just like, oh, after this specific time or after you see this, please come in and get a consultation to see if that's something for you?
Perimenopause, menopause, it's just like when we're going through adolescence. Puberty can start, at very different times for all girls, and the same as, we're all just girls. All through life, we're all just girls. Things happen at different times. Perimenopause happens at different times. Menopause happens at different times. If something feels off or women are concerned at all or, teenage girls are concerned, just come see me. I'll take care of you. I'll listen to you.
Yeah,
We don't have to suffer in silence. We don't have to suffer at all. So come
absolutely.
see me.
And Dr. Payne, where are you located at for our listeners who maybe were like, heck yeah, I want to go get this checked out. I feel like this is what I need to do. Where are you located at? Are you taking new clients?
I'm absolutely taking new clients. I am out in the county at Perry Hall Family Medicine Center. So it's a really beautiful building. It's brand new.
It is, yeah.
And
It is beautiful. I've been there.
it's so pretty. I love it. It's so peaceful out there. So yeah, if for women, men, children, I can see you, your husband, your kids. Just bring them out to the county. We'll get you guys taken care of.
Perfect.
Love that. And since you've been at Health Solutions and you're starting to build that clientele and that patient base for yourself, what are some of the nuances that you're seeing or some of the recommendations for how to live a healthy lifestyle? And what would you say to our listeners who are kind of living through this process of perimenopause or menopause in general? What are some lifestyle changes that they can make for themselves?
I love this question because I think as physicians and even just as any clinician or just person in the community, we always go diet and exercise, diet and exercise.
Yeah. Everybody knows that.
Everybody knows that. And diet and exercise are really important. I think in today's world, what also is really important that we kind of forget about is community. Like having a community, having other women you can talk to going through the same thing. If you're lucky enough to be able to talk to your mom about it, go talk to your mama about it. She didn't get guidance. I'm sure she's happy to give you guidance. Having community, having real connections, relationships, that matters just as much as diet and exercise for physical health, mental health. And then one thing I'm always telling my son is less screen time, more sunshine. So
Yes.
get outside, touch some grass, hang out with your friends, and go see your doctor.
And go see your doctor. Yes.
There's a lot of the times where I think that people are just afraid. I know even within my culture, we don't seek doctors. We're like, well, if we go see them, they're going to tell us that there's something wrong. And then all of a sudden, just everything's going to go down. But like you just said, it's so important to get checked up. And it's so important to have yourself talk to someone because you don't know, right? And if something can be preventable, then why not?
Right, I agree. And I think it's important to know you're not broken. You're not broken.
Yeah.
Things can be normal, but we don't have to suffer through them. Like childbirth is extremely normal, but I don't expect anyone to suffer through the pain of childbirth. So I also don't expect anyone to suffer from really painful periods or crippling mood changes. Perimenopause, menopause, it's the same. Don't suffer through it. It's not that you're broken. It's just that you can also have some support and compassion through that.
Yeah, absolutely. Dr. Payne, you talked about the pregnancy part of it. And I want to say that there are some genetic testing that you're doing before pregnancy as well, too, or during pregnancy, if I read that correctly. Can you tell our viewers a little bit about that?
Yeah, so primary care, whether it's me or someone else, you can always go for pre-pregnancy counseling. So a pre-pregnancy checkup is something I think we don't often know is even available.
Yeah.
So going into the genetic counseling, there's some things even before that. I think a lot of us don't know when to start prenatal vitamins, something so simple. And in order to decrease a baby's risk of open neural tube defect or spina bifida, which is a spinal defect, we actually need to take folic acid about 3 months before conceiving. So that's
Wow.
one of the main ingredients in prenatal vitamins. So, whenever you come in for a pre pregnancy visit, something we talk about a lot is simple things like when do you start prenatals? How do you track your cycle? When can you most easily get pregnant? Other things that we often forget about is our immunizations, not just our flu shot, but did the vaccines we get in childhood, are they still protecting us? So, we can check blood titers. There's a couple vaccines that aren't safe in pregnancy, but are totally safe outside of pregnancy and help reduce women's risk of rubella or varicella, which is chickenpox, which are both, when contracted in pregnancy, can be very deadly. But if we
Wow.
know you're not immune to that before you get pregnant, we can vaccinate you and make sure you have the healthiest pregnancy possible.
Wow.
Yeah,
There's a lot that goes into getting pregnant then, what it sounds
right.
like.
Yeah, there's a lot we can talk about and optimize before pregnancy. Another one of those things, like you mentioned, is the genetic screening. So we're able to do a very simple blood test. It will test mom to see if she's a carrier for things like cystic fibrosis, spinal muscular atrophy, and there's a whole lot more very rare things that it also screens for. So when we're carriers, we don't have any symptoms. So we wouldn't know we were a carrier unless we had the blood test.
Mhm.
So that is something that can really empower you in making your family planning choices, is knowing, am I a carrier? Does my partner need to get tested? With that test, if you're positive, it also comes with free genetic counseling services to kind of talk about what are babies' risks of getting this disease?
Gotcha.
What are your options for lowering that risk? Is it safest to have baby here, or does baby need to be born at a specialty office? Does baby need a specialist like right at birth, or is it something that can wait?
Gotcha.
Yeah,
Wow.
so
Really important stuff to find out then before starting that family.
right. And it helps alleviate a lot of stress. Like pregnancy isn't all rainbows and unicorns, but I want it to be as many rainbows and unicorns as possible by alleviating some stress before that part happens.
Yeah.
Absolutely.
And like that is one of those services that many people don't even realize that we can offer here at Health Solutions.
Yeah.
And so we've really tried with this podcast and with our marketing team and just with our administration team about how do we notify our listeners of the plethora of services that are offered, not only through our behavioral health side and therapy and mental health wellness, but physical side of not just like going to your primary care, but these nuances of genetic testing and pregnancy planning and, hormone replacement therapy. These are all part of that integrated approach of providing whole person and whole centered care for individuals. So we're so excited to have you. Is there anything that you'd like our listeners to know before we end this podcast about, just in general about Health Solutions, about you, or about what you would recommend for them going forward?
Hmm.
Or if there's like a story that a patient has impacted you,
Yeah.
something that you've learned from maybe a patient, whether about by medicine or
Oh.
about life.
Yeah. Gosh, I learned so much from patients. I think the biggest thing I've learned from patients is just how resilient people are. Like, we really have no idea what people are going through.
Yes. And they keep persevering.
They do, and they show up, and you would think, oh, this person has it all together. There's no way they've struggled. And then I'm like in this really great position that I think comes with so much responsibility of being able to hold people's stories and truths and just bear witness to their lives. Because oftentimes we have to show up professionally or in the public when inside we could be falling apart. So
Yes. Yeah.
I love that patients trust me with that. And I also love how resilient they are and how, they're showing up. They're trying to improve their health physically, mentally. And it's just, on a bad day, there's always something worse. There's always another story I can turn to, a patient that's gone through so many more struggles
Yeah.
and they're still going. So I think we can all keep going.
Absolutely.
And the beauty of that is we get to see the progress. Like as
Yes.
professionals, like you said, sometimes
Yeah.
you see people on a really bad day and you bear witness to that. And then you assist and you help and you show up for them. And then you see the progress of that. And
Yeah.
that's pretty amazing.
Yeah, I think bearing witness to that growth aspect is so important too, because sometimes they forget how far along they've come.
Yeah. And you
And
have
we
to point that out to
we
them.
get to remind them, like,
Yes.
hey, remember when this was going on? Look at things now. You're doing great.
Yeah. Look how far you've come.
Right.
Yeah.
Absolutely. Thank you, Dr. Payne, for being on the podcast with us today. It was
you,
a
guys.
pleasure to get to know you a little bit more and to have some really great, insightful things about women's health and just health in general. So thank you so much for being on the podcast. You are not off the hook yet. We have a couple
Oh, no.
a couple more questions. They're a little rapid fire questions, and I always like to say, like, these are going to be questions that are either going to make or break you to our listeners. They're going to be like,
oh, no.
heck
This
yeah.
is like initiation for
Yes,
you.
exactly.
Perfect.
Okay, so the first one is, does pineapple go on pizza?
I like pineapple on pizza.
Everybody
it's so
likes pineapple on
controversial.
pizza.
You are on the right side of
It's a
history.
fruit. We get our fruit and veggies in one serving.
Yes.
Along with all that cheese and carbs. Yeah. They must put that on the application. I must have missed that question.
The no pineapples get thrown out.
Yeah, exactly. Yeah.
Absolutely.
Our other question for you is hot dog a sandwich?
A hot dog? Like on its own?
Mm-hmm.
Mm-hmm.
Or on bread?
Well, yeah, hot dog
In
with bread.
general, hot dog, like a hot dog when you eat it, is it a sandwich?
Ah. I've honestly never thought about this.
Yeah.
It's not something
It's
I think about
mind-boggling.
frequently. Is it a sandwich? Sure. It's meat on bread.
Okay.
I
Keep
guess.
it simple.
Yeah.
Just keep it simple.
I'll go with it can be a sandwich.
Okay.
Absolutely. And then the final one is, what is one piece of advice that you live by?
Ooh, that's hard. I
Yeah.
feel like I live by so many pieces of advice.
What's your tagline?
My tagline.
It's your signature.
It's cursive.
Yeah.
I think it's that. And tomorrow could be better. Maybe today's bad, but tomorrow could be better. Nothing
Mhm.
lasts forever. Life is just a series of ups and downs, and we can swim against the wave, or we can just kind of roll with it. So
Absolutely.
That's amazing. We love that. Tomorrow
Yeah.
can be better. And we're so happy again to have you. Thank you for being part of our podcast and joining us today. It's been a pleasure, and so much has been learned for both of us. And I know our listeners appreciate all the wealth of knowledge that you bring to not only Health Solutions, but the community in general. And glad we got you back from Africa and got you here in Pueblo, Colorado to be part of our community. So thankful for that. For those listeners, if you are struggling with a mental health need, please remember that 988 is available, as well as our Crisis Walk-in Center, which is open 24/7. You can call or reach out, and Mobile Crisis can come to you if you're struggling with a mental health crisis. And as always, Health Solution is here not only for your mental health needs, but also for your physical health needs, and as we learned today, for women's health as well. And we're again so happy to have you, and thank you for being here.
thank you, guys.
Thank you, Dr. Payne.
Thank you. I appreciate it.